I've just had a message from IT to say we're now live, Josh.
Okay, that's great. I will give another couple of seconds for another couple of our members to get here.
Okay, no apologies.
Flick nah. Oh, I received a couple of apologies for lateness from Kim and Jim. But are you able to give Na and Te Atu a text on our behalf, please, Rach?
Yeah.
Morena, Nicola.
Morena. Sorry, I just lost
Just getting a text from Na now. Oh, he's an apology for lateness. He'll be here in 10 minutes. So I'm comfortable kicking off. One, two, three, four. Check. One. All right, whānau, I think I'll just kick us off because we have we do have a quorum here. We have some apologies for lateness due to all of these the unprecedented, uncertain times that we're all under at the moment, and people will turn up as they turn up. I'll kick ourselves off with a brief karakia. Me nui tātou. Manawa mai te mauri nuku, manawa mai te mauri rangi. Kei ahau te mauri tipua, kei ahau te mauri tawhito, kei ahau te mauri no hea. No tiki o rangi no te waioro o tāni te waiora. Tēnei te mauri ka whakapiki, tēnei te mauri ka whakakapi. Tēnei te mauri ka puta ki te whai au ki te ao marama, ki te matatauira e tuake nei. Uhi, wero, tau mai te mauri, haumi e hui e, tā ki e. E mihi ana ki ngā tini mate kai runga i a tātou, ko te hao te ngā kau e hika mā, kia koutou kua nunumi ki tai whetu ki o te pō, haere whakangaro atu rā koutou. Hoki mai ki a tātou te kanohi ora, tēnā rā tātou katoa. Good morning, everybody. Great to see us all. Thank you very much to our board members that are here. I want to acknowledge Andrew Potts also in the proverbial Zoom room, here for introductions to our Hiwa Te Rangi committee. Acknowledge yourself too, Rachel, for your diligent mahi and behind us all in order to be able to make this as seamless as possible. Thank you very much for being here too, Nicola. Very pleased that you're here, considering that you're super under the pump in regards to what the nation is under at the moment. So yeah. I'll kick us off. If there's anything, excuse me, just need to clear my throat. If there's anything changes to the interest register that we need to make, please email those through to Rachel. I've already mentioned our apologies, and those people will be here in due time. Minutes of the previous minutes. Do we have any questions, any matters arising from the previous minutes? If there's no matters arising, I'll take the minutes as accurate. And then we'll move on to, well, this is where we'll slot in our kōrero with Sonia Smith and Andrew Potts. I'm I'm unsure where Sonia is, but you know, like with what we're going through at the moment, with all of our medical staff kind of in the space that they're in at the moment, like I actually wasn't even expecting either Sonia or Andrew here this morning, to be quite honest. There's a lot bigger fish to be frying out there. But I appreciate you coming this morning, Andrew. I'll hand it over to you to I guess introduce yourself to the members of Hiwa Te Rangi. And I'm pretty sure that the majority of us did actually introduce ourselves to you when we're at the board, but just kind of to give you in a nutshell, Hiwa Te Rangi is our all of health systems committee. So previously we used to have an ADSAT committee, which is Age Disabilities Care Committee, a CFAT committee, which was Community Public Health. So like all of these systems committees, and then we kind of we've joined them together. We just have Te Atu coming in just now. Morena Te Atu.
Morena, Josh.
So Hiwa Te Rangi, I'm just talking to Andrew. Pot's at the moment there. Atu, he's our new GM for medical, and he's about to introduce himself. Great to see you this morning, Whanaunga. Yeah, glad that you're here. We have Nal has an apology for lateness, and so does Jim, and so does Kim. But they'll be here in due course.
My computer sorted out, something wasn't working properly, so I'm here now.
Kei te pai. Yeah, so Andrew, that's Hiwa Te Rangi is all of health systems committee, and we're made up of some people that are from our health board and some nominations. And we have a community feed into the spaces as well. We haven't been able to exactly land it the way that we envisaged when we first set our yearly plans because COVID happened right in the middle of it all, and then it's now happening again. So, but that's the nature and the essence of this committee. So I'll hand it over to you, Andrew, to talk to us a little bit about yourself.
Morena, Josh, and thank you very much for this opportunity. I should just acknowledge my colleague Sonia. I think she's probably in the operations centre, as I know she's volunteered for that. So that's probably where she is and why she isn't able to say hello also. I think the board meeting a month ago was day one for me, and I did introduce myself then to some of you I know, so apologies for replication. I am the new group manager for medical services, arrived from England in July. I have previously worked in Auckland and Northland, so not completely unfamiliar with the health sector more broadly, but certainly been familiar with Tairāwhiti. But I know a little bit more than I did then. And it's probably a week ago I would have said my biggest priorities were around older people's services and long-term conditions and achieving improvements in them, greater access, greater equity, and generally more responsiveness, I think would have been my priorities. They still are, though obviously in the last week things have changed a bit operationally, so some of the focus is on that properly now, but hopefully we'll be able to continue with forward momentum in those areas. We're certainly trying to do that. So that's a little bit about me, and I don't, if anyone's got any questions, that's fine, but if not, very happy to get back to the grindstone and let the meeting carry on. But thank you again for the invitation.
You're welcome there, Andrew. I just need to give the whānau a heads up as well. My internet connection is a little bit unstable.
A lot of Zooming going on, Josh.
Sorry, what's that?
I was just saying that a lot of Zooming's going on.
Oh,
Just
yeah.
probably overloaded.
Yeah, there's actually several other teenagers in my house that are also using the internet in order to be able to stream their lessons and things like that. So just kind of giving us the heads up that if I do pause or stutter or anything like that, that's probably the reason why.
It was a
perfectly timed statement, Josh, because you dropped out just after you said it.
Okay. Hey, thank you very much for that kōrero there, Andrew. Appreciate that. We will move on in regards to our agenda. So being through our interest register, please update that with Rachel. We have our minutes which have been passed. We'll move to our action items. I mean, the main action item there was the vape statement, position statement coming back, and that's here in this agenda. So we don't really need to discuss those. I'll move us to our on page 11, our shared services report. I'll take the report as read. Do we have any questions in regards to shared services? Kia ora, Sandra.
Thanks, Josh. I see our telehealth project manager has resigned. I wasn't sure if that was the result of the project not working as well as he had hoped, or whether it was the end of his contract at that stage. So two questions. One was around where he got to, but also what is the Tui Te Ora project, please?
So I'm going to answer as best I can because this is provider work, Sandra. We can ask Jim for the final update of where the telehealth project was left. He's been quite thorough in ensuring that those weekly updates are managed.
And my darlings, are you guys streaming at the moment? You guys aren't?
Josh, can you turn off?
Oh, sorry.
Now we've lost you, Nicola.
Nicola, you're muted.
I'm unmuted now. Okay, so and the second question was, what is the project around Tui Te Ora? So there was a piece of work that was undertaken in to review so Tui Te Ora is ostensibly is our outpatients appointment centre for those people who have long-term conditions. And it was developed to ensure an ease of access for people not to be waiting long periods of time for work that was still needed to be provided by specialists. And there was an agreement that we would review how that was running, what would be important for moving forward. It has a range of different people who input into it. So that's what it refers to. There was a review that was undertaken, and my understanding is that the provider arm is now thinking about what the recommendations of that review will look like in reality.
So just very quickly, was the outpatients work that you talk about, was it done by telehealth, or was it done remotely, or was that a project that ran through the hospital, for example, or through one of the providers' centres?
No, the work of the telehealth project manager was to look to see where the improvements and benefits would be in telehealth. Tui Te Ora was part of that process. So if you think about the fact that they're dealing with outpatients, could there be an improved way for that work to be done? That was part of the broader review undertaking as well. And so that's what that comment relates to.
Excellent, thank you. No, I just I wanted to know how they mesh together, because for our remote communities, it's really important that this work carries on. So thank you.
Yeah, so that was part of the Tui Te Ora program of work to understand what could be improved with that particular component of care. There have been a number of different elements that have been included in thinking about how that could be improved, including telehealth, but not just telehealth.
Awesome, great. Apologies for that, whānau. I had instead of muting, I realised I'd turned my video off, not muted my mic. Na is just joining us. Kia ora, Na. Do we have any other questions? We're on shared services report, which is page 11. Do we have any other questions in regards to shared services? If not, I will move us to page 12, which is surgical services report. Do we have any questions or kōrero in regards to surgical services report? I'll take the report as read. Oh, yep, kia ora nā. Oh, you need to unmute, dear Hauora.
It's a tricky machine this morning. Morena, kia ora everyone. Just a question I wanted to ask around the, if I may, around on the right-hand box, the planned care, the actual 164.5%. Just clarifying in my head, that means we've done, I don't know, 70-odd% more than what we had targeted on the FSA target, just as an example. Is that right? Oops.
No, I confirm that's how it reads.
Yeah. So well, I guess what I'm saying, that's so that's obviously due to demand, yeah?
I'm not sure that it designates whether it's also as a result of clearing some backlog.
Oh, okay. Okay. Either way, that's a rather large increase, which is a good thing as I'm reading this.
Yep.
Cool. Copy.
Any other questions or kōrero regarding surgical services whānau? Because if not, we'll move on to medical services. I was also going to mention the FSAs, but you know, it's already been mentioned. No need to do it. It's already tricky. Kia ora, Auntie Hiki.
Morena, Josh. Morena whānau. Just, I think we need to note the risks in the bottom right-hand corner, the recruitment with increasing difficulties recruiting to the nursing workforce. I think we're going to find that throughout the reports. Kia ora.
Thank you, Auntie Hiki. Kia ora, Andy.
Yeah, thanks. Couldn't find how to put my hand up. I usually know, but it's not on the screen for some reason. Yeah, under the medical services, the timelines for the finalised plans for the stroke services. Do we know what the timelines on that plan are? Or?
No, I can't answer that at the moment. Sorry.
Okay. Yeah,
I'm sure Jim would be able to if he was here, but I just to share that I also met with the stroke services team when they came through. We tried very hard to get stroke as a standalone, as an equity response in our regional planning. Unfortunately, it wasn't prioritised as a standalone program. It sits under the cardiac program in Manawataki. So there will still be work that's occurring, but I would suggest that the regional approach is probably going to benefit us more in this year than a national approach, because the national protocol's been has a range of different things, including very clinical and technical elements. That would include the clot retrieval program and all of that. What we've understood locally has been that there are very few services available for whānau who are And when I say whānau, I mean the whole whānau. When someone has a stroke, it's the whole whānau that's affected by it. And so when whānau have a stroke, there are very few services locally available to help to support them through what they need to understand, both with the individual who's had the stroke and what they may need to do themselves in supporting that person back to the recovery level they can reach. So there's quite a bit of work that we would like to undertake in this year to respond to stroke. That's at one end of it. That's very much around supporting whānau to live with stroke. And then at the other end of it, there's the preventing stroke, preventing all of those lifestyle impacted illnesses that we get longer term. But this is about the inpatient service.
Yeah. Thanks, Nicola.
Do we have any other questions in regards to medical services? Because if not, I'll take us to Te Ara Maioha, mental health and addictions. Te atu, you're muted here. What?
Just a point that Hiki had raised. I had noted that also about vacancies, and it does appear again in Tui Te Ora. So when we say a number of senior nursing vacancies, what percentage is that?
Thank goodness Jim's arrived in the nick of time.
Morena, Jim.
Morena. He's just also just finding the actual agenda.
So Jim, if I can summarise, throughout the reports from the DHB services, there are notes, there are risks around RNs and recruitment to roles. Specifically with the medical report, there's a note regarding senior nurses in Tui Te Ora, in the shared services report. There's a particular note about senior nurses in Tui Te Ora. There was a question around what does that mean? Is that correct, Te Atu?
Percentage.
Yeah, percentage, sorry.
I don't have a percentage, Te Atu, but there's certainly varying degrees of shortage of nurses in different parts. So that report around Tui Te Ora is showing that there has been particular concerns around the dialysis services, but that's starting to come right again now with some recruitment there. But there are ongoing issues around the numbers of mental health nurses that we've got, both within the ward and in the community. And at the moment, the community-based nurses are helping the ward to make sure that there's coverage on a shift-by-shift basis. And so definitely we are looking for registered nurses that want to work within mental health and other areas as well, of course. The supply of registered nurses seems to have dried up across the country. So this is not just in Tairāwhiti. We are expecting that the next round of graduates that won't come out till the end of the year. There's not a large numbers of those that are being trained in Tairāwhiti this year. Seems to be in a lower year, so that won't be helpful. But we do also get other graduates from around the country that have got a link to Tairāwhiti. So we are hoping to be able to do that as well. We've put in around mental health. We put in a particular training program, support program around people who are graduate nurses that want to work within mental health area. And we've got, I think, about 3 of those that are currently getting into the workforce there as well. And the other issue is that the supply of nurses from overseas has dried up as well at present, getting through the border. People, A, are not wanting to leave their home countries, and B, getting through the border is difficult. And then C, the amount of people that can get into training bridging programs in this country called CAP is stopped because those programs are not available and people can't come across into the border anyway. So that has created that problem with having a numbers of people available to be able to join in the nursing workforce. So we are having to be resourceful. We are having to look about how we can support registered nurses to work at top of scope and have other people such as healthcare assistants providing more basic support around that as a strategy to be able to staff the ward. Obviously, you can do that to an extent, but not completely. Hence the fact that we've been using to backfill from other experienced registered nurses working in other parts of the system to be able to do that. So that's the status, really.
Yeah, thank you, Jim. So I was wondering if the current number of senior nursing vacancies is associated with the strike action and the discrepancy over wages and people leaving?
What we're finding is that we're not seeing a lot of people leaving our services. We're seeing people shifting between parts of the organisation. One of the phenomena that we've had from the period last year that it was unsettling for many people. We've had some older members of our staff or people who've got other family commitments deciding to either leave nursing or retire, or reduce their hours of work, and that certainly has lowered the shifts available on a day-to-day basis, and not seeing the normal what you would see following that is more people coming in. We're mindful of the fact that when the pay negotiations and particularly the pay equity settlement is completed, what we saw last time when there was a substantial rise in nurses' salaries, that some nurses decided to reduce their daily or weekly commitment and reduce their FTE. And so that will be a pressure point there, because we're expecting that to occur as well once the pay equity settlement is completed by the end of November this year.
Thank you, Jim.
Kia ora, Jim. Thank you for that. Kia ora, Kim. Good to see us all here this morning. Do we have any? We're on Te Ara Maihoha, Mental Health and Addictions, page 14. Do we have any other questions in regards to that report, whānau? Ka pai. If not, I'll move us on to page 17, Women, Children and Youth Services report. Take also that report as read. Do we have any questions in regards to the Women, Children and Youth Services report? Kia ora, Andy.
Yeah, kia ora. The negative pressure rooms, I wasn't sure whether awaiting funding meant that it had been approved and we're waiting receipt of the funding, or whether there was still an issue getting it approved, because I think I think we were going down the lines of COVID responsiveness for funding for that, so it could be opportune. I'm just not sure where that's sitting at the moment.
Yeah, so I can update on that. So that was the funding, the extra $575,000 that we didn't have, and we went back to the ministry to provide for us to enable that work to occur across all of the areas that we're having the oxygen and environmental work done, because we're wanting a level of specification that is higher than what initially the ministry was wanting to do, and we have had that confirmed that $575,000 will be available from the ministry, and so the work is proceeding. We have just had advice this week and confirmed, of course, that this is a priority project and can continue on while alert level 4 is in place, because it is around about improving the capacity within the health system. And so we are continuing to plan for that work to occur, but we will of course need to, there is the practical issue around scheduling that to be able to be done while the hospital is still operating, and operating in an environment, an enhanced environment at present, with the risk of COVID-19 within the community. And also, as some of that work needs to be done in the paediatric ward, we also know that that ward is under pressure at the moment with the numbers of children being admitted with RSV within the community. And so a bit of juggling to do to make sure that we maintain that capacity and also are able to do the work.
Yeah, that's good, Jim, because I was aware that there was spatial issues coming on in the children's ward at the moment. So just wondering how it's going to be accommodated up there.
Well, we have got plans in place at present to enable us to have the capacity should we need to go further. At the moment, we seem to just be able to manage within the footprint of the children's ward with the numbers of children coming through. But if that was to escalate further, we have got a plan around how we would accommodate children to enable us to keep everybody safe, the staff and the patients safe over that period of time, and the whānau as well, managing the RSV issue alongside the possibility of COVID-19, alongside the staffing required to do that.
Thank you, Jim. Thank you, Andy. Sandra, and then after Sandra, Auntie Hickey.
Hi, morning, Jim and Kim. Nice to see you. I bet you're busy right now. My question was just around, and it's so frustrating when new projects get hobbled by things like COVID when they come along. Our East Coast Oral Health Service had basically just got its wheels rolling by the look of the timeframes around it. Just wondering how they were getting on. I understand, obviously everything would have screeched to a halt again now, but was it being well received? It's such an important thing in our schools in Kura, and I was just wondering, how they'd got on until we came to a screeching halt again.
Can I just clarify, are you asking how the mobile dental service was doing at the coast? My understanding is that there is a very good relationship with the principals of the schools up the coast, and Amber Dental is working actively in that space, and they have recently indicated they will be working with Ngāti Pro Hauora, because we have some funding remaining from the overarching agreement to put into Ngāti Pro Hauora for kaiawhina working alongside of young people to enable better dental care. So it's in a screeching halt because everyone's closed down, not necessarily because,
No, awesome. Thank you. I just, I got really excited when I started reading about it, and then I went, oh, damn it.
What is exciting about it is the student who's really enjoying it, apparently, from the report.
Yes, that report, Te Rangi, was part of the interprofessional education program that Hauora Tairāwhiti has with Otago University, and part of that report was included in their final presentation on their last day of the last block, and some really excellent relationship building with that project.
Fantastic.
Well, Auntie Hickey, did you have a question?
Yes, thanks, Joss. Morena Jim and Morena Kim. I was thrilled to see the joined up relationship with the outreach service with Tūranga Health and Well Child. Just asking, will we see the report and how that's going?
So we've got quite a bit of work going on there with Tūranga Health between our outreach immunisation service as one of a different way of approaching the way of working there, and that is showing that joined up approach is proving more useful for whānau. And you will see that there's a report later on the agenda around what we're doing around working differently about improving out immunisation rates for childhood immunisation rates. So that work that we're doing with Tūranga Health there is showing up how a different way of working may actually be more effective for whānau. And so it's really a kind of sort of proof of concept type piece of work that we're doing with them, and of course enabling those families to ensure their children are vaccinated right here and now.
Kia ora, thanks for that, Jim. In that same vein, I did want to know, would that still be continuing during this time, or is there going to be the same amount of pause of level 4 lockdown weeks added to this time frame? Because this is great. This is great, but I just did want to ask that. I'm assuming I already know what the answer will be, but also just wanted to ask that plainly as well. Still muted, Jim.
Yeah, I know. Sometimes the space bar works, sometimes it doesn't. And Nicola might have a comment on this as well. But childhood vaccinations during alert level 4 are a priority area. We do, however, recognise that families do have a concern about bringing their very young children out of their homes at this time could be an additional risk. So we are expecting that the rate will drop off a little bit during this alert level 4 period of time. But again, we will need to boost that up again once that is ended. The other rate limiting step at the moment too is that the outreach immunisation service and general practices are very much and public health teams are very much involved in 3 areas around contact tracing, around vaccination, and in swabbing. And so, we can't pull people in every direction at once. So we'll get over this initial little hump here around on some of those other 3 areas, and then get back into to really working on childhood immunizations. It's unfortunate that what we were seeing just before this all happened was quite a good boost up in vaccination rates, and that progress will be lost for a little period of time.
Awesome, thank you, Jim. Kim.
Thank you, Josh. Morning, everybody.
Oh.
I just wanted to I just wanted to really applaud the efforts of everyone on those stats for childhood immunisation. It's great to see that upward shift, and also on the coast-based obstetric and gynecological clinics. Again, that's another fantastic thing. So ngā mihi.
Kia ora, Kim. Nicola.
Just to note that I was talking with Ngāti Hauora team, and they're spending the next month or two just revisiting the immunisation protocols and programs they've got, including MMR. So it's just they're trying to build at this point in time some return to trying to get those immunisation programs up and running again.
Awesome, thank you, Nicola. But I actually absolutely endorse what Kim was saying in regards to not only the stats, but also what Auntie Hickey was saying in regards to the plan. This is a really great plan, joined up plans. It's fantastic. If we have no other questions in regards to that report, I'll move us to the following report, our Hauora Tairāwhiti COVID-19 vaccination update. Also take that report as read. Do we have any questions, whānau?
Just with the border workers, what's the percentage that have now been vaccinated, please?
I don't think we've got an actual percentage to Rangi. I just know that prior to the little changes that we've had in the last few days, that there was I think there's about 55 people to do, and I know that almost half of those people were done by Tūranga Health in the days before we went into lockdown. So I'm not sure that the rest of those have been completed yet, but Nicola is going to add in something about that.
Yeah, they're down there tomorrow. They're at the port tomorrow, testing and vaccinating.
And I think it'd be good to take questions on the report, because you need to recognise that is kind of very, very much outdated now with the incredible boost in vaccination that we've had in the last 4 or 5 days.
Cool, thanks, Jim. Andy, and then Sandra.
Yeah, thanks for that. There's been a lot of speak going on recently about the timeline between the first and second vaccination. Is there any clarity around that, or is that information? The information seems to be out to 12 weeks now between the first and second, but you don't know who to trust anymore when you see all that information. So I'm just wondering whether that's valid, or what are the recommendations at this stage?
You're able to get your second vaccination between 6 and 12 weeks, Jim? Just checking.
Well, it's got in the report, it's got 3 and 6 weeks. and when I booked mine, they rebooked my second. Yeah, they rebooked my second one for 3 weeks later. But there's a lot of dialogue out there at the moment saying that it may have a better effect opening that gap up, but I don't know if that's valid information or, yeah.
So the standard timing is now moved to 6 weeks between first and second doses. Although for some people, it's still 3 weeks as being seen as preferable. For instance, people coming into the health sector, working in the health sector, are being offered to have their second dose within 3 weeks, so that they get sooner protection rather than waiting for the 6 weeks. But the general population are being offered a 6 week gap between doses. The reason for that is the latest evidence around it in terms of immune response. It's not a major difference in terms of immune response, but it is of benefit. So that's one reason. The second reason is that in the current circumstances, it allows us, given that first reason, it gives us much more opportunity to get a lot more people with their first dose, because we've now got 6 weeks before we have to come back for the second dose for those people. So it allows us to give a big boost around that. And the third reason is that there's a extremely rare complication that is affected by a longer gap between the two. So that's the third reason. I think that all that information is all out there on the Ministry of Health's website if people want to check in on that.
Okay.
Well, thanks, Sandy. Sandra? And then
Yeah, so I want to throw bouquets and frolic around in meadows of them, quite frankly, having had my first vaccination right here, almost in my backyard. So whoever it was that planted the seed of the idea of having the rural township rollouts, Tairāwhiti Health at the Marae, all of that sort of thing. The reason I'm so excited about it is that talking to people up and down the length of the country, the frustration, well, we hear it on the news, don't we? The frustration around the booking systems and all the rest of it. And when I talked to my rural counterparts up and down the country, and I said, oh, I just popped down to the rural township and it's all done down there. And they went, there is no way on the planet that we could do that here in our part of the country. So, I just cannot congratulate enough whoever it was that seeded the idea, pushed it through. It is just fantastic, and it is such an extraordinary opportunity for this region. So huge thanks to whoever that was.
Yeah, I just want my position as a director of Tairāwhiti Health noticed. What we did, Sandra, was we identified very early on that being mobile was the answer to getting around and making it easy for people. So basically that's what we've done. We've come up with a plan and just fired ahead with it.
awesome. Kia ora te atu. Nā.
Oh, thank you, Josh. Yeah, again, congratulates. In that paper, there's a whole lot of work being done at different places. It looks like we've got like 2,000 people administering doses by the number of different places that are going on. I wanted to, but some of the stuff is out of date. I think Jim mentioned it earlier. In the last paragraph of that page, it talks about getting up to, well, that was from the 14th of August. So it talked about getting up to 3,600 doses per week. Are we on that target now, Jim?
Yes, we are absolutely on that target now. So first of all, just coming back to the point about rurally based vaccinations, I think that I know that all of us, and I'm meaning across our iwi providers, Hauora, Tairāwhiti, and generally in the community, the view right from the word go right back at the start of this whole pandemic was that we were not on our watch while we were going to repeat the pandemic, the flu pandemic of earlier in the 20th century, and the devastating effect it's had on Māori, on rural people, and that. So that's not going to happen here this time, and so hence, we knew that for vaccinations that we would start rurally, and we did. So yeah, it's good to hear that that's been well received, and the turnout, rurally has been good. But there's more mop-up work to do, and I know that Tūranga Health are in Matawai as we speak, and about to start vaccination at 10 a.m. there in that community, and I hope there's really strong support from the community there today for that. Coming on to the numbers of doses per week, 3,600 last week, even with losing one day when we went into alert level 4, we were able to complete 4,100 doses in that week. So that was some 500 more than what we had planned. And we had a little bit of a hiccup there in terms of getting our capacity up and running in a number of places that we had intended. So we have got a little bit behind on our schedule. So that kind of performance is enabling us to catch that up very quickly. And so that we can keep ahead. And already we know that this week we completed, or collectively, and I use the word collectively, 1,118 doses yesterday, which is some 500 more than what we would be planning to deliver on a day. So that rate of and that pace of vaccination is continuing, and we want that to continue as long as we possibly can, bearing in mind that actually is, as you mentioned, requiring quite a large numbers of people to be able to do that, and we do need to manage that over the coming weeks. We've got another 10 to 12 weeks or longer of the vaccination program to go, and we don't want to burn out our teams, and need to provide as much support as we possibly can over that time so that they can maintain the pace. So so that's why the situation has changed quite significantly from last week, where we've been getting those days from Saturday last week of very large numbers of people coming through the 3 sites that we've had operational most days.
Cool.
Awesome, thank you, Jim. Do we have any other questions or kōrero? I did just want to ask a question about doses. Do we have enough doses in our community in order to be able to deliver the what we need to? Or do we have enough here in Te Tairāwhiti?
Absolutely.
Yeah.
Awesome, thank you. There are no other questions or kōrero. I do just really want to commend our staff, the staff that are doing the mahi in the Potama room, the whānau that are our iwi partners as well, Tūranga Health and Te Runanga o Ngāti Porou, Ngāti Porou Hauora, absolutely massive. Me and my whānau, we went and got our first vaccinations down at Te Tini o Porou, stood in line with everybody else. I had some people go, "Oh, we thought you would have already been vaccinated," that kind of thing. I was like, no, I wanted to make sure that I waited in line like everybody else and got it when everyone else got it, So I went down there and got our vaccinations, and everyone it was a great way to in the line and in the building. So just really want to commend everybody that's doing all the things in order to be able to ensure that safety and security of our region. So absolutely massive whānau, absolutely massive. On that note, I'll move us to page 21, our position statement, vaping updated Owahi Kore smoke-free position statement. Take the report as read. Do we have any questions or kōrero? Andy.
Yeah, thanks, Josh. A lot happier with the statement as it sits at the moment. It seems to have addressed most of the concerns. The only concern really is probably based on perception and hearsay, and that's the comment under bullet point 9 on vape key messages, which states vaping products are attracting very few people who have never smoked into regular vaping, including young people. But like I say, that could be perception and hearsay around my thoughts on that. But other than that, I think it's a very good position statement.
Thanks, Andy. Any other questions or kōrero, whānau? Kim, and then Ati Hiki.
Sorry.
I was just wondering, do we have, so at the very beginning of that, we've got we've got percentages that are Aotearoa percentages. Do we have any Tairāwhiti percentages to give it a more of a local flavour?
I'm sure Ian would have checked, but I will recheck with him.
Thank you.
Auntie Hiki then Te Atu.
Kia ora, Josh. This doesn't relate directly to the statement. However, I think it's relevant. Do we know whether there's been an increase in the number of outlets selling vaping products in our community since this all started? I was really shocked when I walked into a local dairy in my daughter's neighbourhood, and here was this shop had been altered so that they could then, offer vaping products. So my question is, do we know if there's been an increase in the number of vaping outlets in Tairāwhiti? And is there any concern if there is an increase?
Without doing any scientific method to say yes, since vaping became popular, there has been a rise of vaping outlets. This particular position statement was generated as a result of the local community, with one where one was being proposed, actually challenging the owner of the shop not to, and that was successful. There's no legislation at this point in time about where and when you can and whether you have to go through a process. Oh, you do have to, but there's no legislation around numbers of in the same area, all that sort of stuff at this point. Like outlets, for example.
And Hiki, it would be preferable if the shop that you're talking about at the same time closed their sale of cigarettes, and that was another step along the way to smoke-free Aotearoa 2025.
Cool, thank you, Nicola. Thank you, Jim. We go to Te Atu and then Sandra.
Yeah, it's really just a personal position in terms of vaping almost being promoted over and above smoking. And, it is noted that experts say that vaping products are much less harmful, and, you have to agree with that, but they're not, fresh air is good for us, not vaping. I don't know what we can do to promote. It's just frustrating, that's all, to see that one is being promoted to replace the other because it's less harmful. But I guess it's all.
I think it's important to note that vaping is not being promoted as anything more than a method of people reducing a harm reduction method for the harm that is involved in smoking, cigarette smoking. So people wanting to utilize nicotine, if they do want or need to do that, then the better way for them to do that is vaping, but preferably not at all. So yeah, if we're not still getting that message through, that this is not about promoting vaping, it is actually saying vaping is a way to enable people to reduce and minimize the harm involved, that is clearly involved in cigarette smoking. Every cigarette does somebody harm, it does a person harm. Is a way of doing that, then maybe we do need to put a bit more effort into this statement to get that message across. So we're not promoting vaping at all. We are saying vaping is a way of enabling people to move along the pathway to quitting, much the same as nicotine replacement therapy is a method as well.
Yeah, no, I do get that, Jim. It's a matter of how you read it and how you perceive it.
Cool, thank you, Te Atu. Sandra.
For me, it's always wordsmithing. It's how you get the message across of what you're actually talking about. Our position statement is not actually that second part of this document. The position statement belongs up the top under the Hauora Tairāwhiti position statement. Now, the first section of that is fine, but what needs to be added to that is, and it's buried right down in the bulk of the document, is the fact that vaping products have the potential to make a contribution to the smoke-free 25 goal and could disrupt, so basically what I want to do is take a line out of that vaping section, and it could even be as simple as vaping products can help people quit smoking. Put that at the top, and then take out that second position statement, because that's not our position statement, that's just facts. So basically our position statement reads the first 3 lines, plus vaping products can help cessation of smoking cigarettes, or however you wanted to put that, because that is our message. Get rid of the second lot of position statement, leave it at smoke-free, because that's what we're talking about in that section, and then talk about vaping. But our position statement needs to include at the very top something about vaping being part of smoking cessation. That is our position. Your thoughts?
Thank you, Sandra.
My thoughts on that, Sandra, is we just again we just need to get it as clear and as easy to understand to people. So yeah, totally happy to move that wording around, because it really just needs to give them messages that when people read it, they're getting that message that the goal is around smoke-free Aotearoa, smoke-free Tairāwhiti, and there's ways of doing that, and vaping is one of those ways that is helping to enable that to happen, and it has an immediate benefit of reducing the harm that people, as we speak, are exposing themselves to.
Do we run the risk of slowing everything down horribly if we just ask to see this again next month, just with those couple of changes made? Because I just sense, listening to Atu as well, we're just not quite there yet.
Well, I was hoping that that people are taking notes, because I'm thinking that maybe if we can get some agreement out of today, that we could just make those changes for the board next week, and then that would be it.
Can I just clarify, Sandra? You're referring to 3 lines of a statement. So at the front of this document, we've got position statement, auhe kore smoke free. And
that's not actually our position statement though, Nicola. Our position statement is actually the 3 lines right at the top.
But so I was just going to check something else that will be added, and thinking about it, because then at the final part of the paper, you've got Hauora Tairāwhiti board is committed to, and all of those dot points. So we use the top 3 lines, shift Hauora Tairāwhiti board is committed to, and add that further dot point in regarding the comment you've made about vaping being part of a smoking cessation program.
Yeah, well, I just wanted to keep it simple, Nicola. I mean,
and that
I
would
appreciate that we've all read the whole document, but a lot of people won't read the whole document. They're going to read the paragraph that starts, in 2011, New Zealand adopted the goal to reduce smoking. So that's a position statement, that we're part of that. All I was going to do was, as part of that, and it may be in a separate line, because this is about vaping, below those 3 lines, it says vaping products can help people quit smoking. That is our position statement. So it's pretty simple, and you can drag. I would leave it where it is, but edit too. No, don't play with the dot points.
No, I was thinking, sorry, Sandra, I was thinking the majority of the rest is talking about vaping, but if we took the first sentence, then said Hauora Tairāwhiti board is committed to, that then covers off both your areas, but it also expressly indicates what legislation and so that then becomes the position statement. The first 3 with that, what Hauora Tairāwhiti board is committed to.
Yep.
Right.
I mean, I just wanted to keep it simple as you prefer it to be, but our position statements need to be at the top and simple.
Yep,
Yeah.
one is very limited in terms of 3 lines, and people will go, what does that mean? So
Yeah.
if we added those dot points, it tells people what it means.
Yep.
Okay.
If the others are happy, I'm happy with that. And then take out that second position
Take out
statement.
vaping, all of that, and take
Yeah.
out, so that becomes the position statement.
No, don't take that out.
Yeah, no, don't take it
No,
out.
no, don't get rid of it. Just, yeah, it's just that second
Just the heading.
blue bit.
So the heading is not
Yeah.
correct, but all the information is in.
Yes, it is.
in
Yeah. Yeah.
context or something like that.
What I'm,
That's
what I'm hearing is to remove all of the information regarding vaping that sits there now.
No,
No.
I'm not doing a very good job of explaining this. I might leave it to Kim. Do you get what I'm
Yeah,
saying?
I do. Look, maybe it might be easiest if you flicked a Word copy out, and between Sandra and I, we can just maybe make some track changes, because I think you and I both have a view of what we're saying, and then flick that back to you, Nicola.
Yep, that would be helpful. Thank you.
Awesome.
Yeah, I
Thank
agree.
you.
There's actually 2 statements there. And the first one needs to reflect what the rest says, but the rest is really background information.
Kia ora, te atu. Now, did you have anything to say there?
No, I'm suitably confused. I like the idea that between Kim and Sandra work with Nicola on it, but I would suggest if the goal was to get it to the board, otherwise it's another month of dragging it out. I just think there's just a few lines going in and get it to board.
Yeah, I agree. What I'm hearing around the table is that we're in support of the bulk of the messaging, like all of it actually. It's just shifting little bits around in order to make it clear for our community and also still maintain how well informed it is. Yeah, so I'm happy for how we move progress this moving forward. In terms of what we need to do, I think we should still support the attached position statement, noting that there will be some little tweaks and moving forward, noting the process that Kim had kind of outlined just before. Are we happy with that as a committee?
Yeah.
Ka pai. Awesome. Thank you very much, whānau. On that vein, I'll move us to our in-committee space. If there are any members of public here, thank you very much for attending. I'll make a resolution to move us into in-committee as noted in our papers. I'll wait for the live streaming to click from live streaming over to not.